structured approach for managing a patient with suspected diabetic ketoacidosis, DKA. History taking, presenting complaints, tiredness, abdominal pain, increased frequency of urination, fever, associated symptoms, nausea and vomiting, thirst and dry mouth, weight loss, palpitations, past medical history, diabetes, type 1 or type 2, hypothyroidism. If not diagnosed, consider screening, medication history, insulin or oral hypoglycemic agents, compliance with medications, social history, alcohol intake, smoking, recent infections or stressors, examination, observations, vital signs, BP, HR, aura, temperature, oxygen saturation, physical examination. General, look for signs of dehydration, dry mucous membranes, poor skin turgor. Abdominal, tenderness, guarding, distension. Chest, auscultation for any signs of infection, example, pneumonia. Investigations, bedside tests. Urine dipstick, for ketones and glucose. Capillary blood glucose. Laboratory tests. Arterial blood gases, ABGs, to assess acidosis. Full blood count, WBC may be raised. Electrolytes, especially potassium. Blood ketones. Imaging. Chest X-ray, CXR, to rule out infection. Erect abdominal X-ray if abdominal pain is significant. Management. Initial management. Fluids, for 0.9% sodium chloride solution to correct dehydration. Insulin, for insulin infusion to reduce blood glucose and keton levels. Electrolytes, monitor and correct potassium levels. Pain relief, analgesics as needed. Oxygen, if hypoxic. Antibiotics, if there is evidence of infection. Monitoring, regular monitoring of blood glucose, ketones, and electrolytes. Continuous cardiac monitoring if potassium levels are abnormal. Patient education. DASA, diabetes education and self-management for ongoing and newly diagnosed. Educate about the importance of medication compliance. Recognize early signs of DKA. Importance of regular follow-ups and monitoring. Lifestyle advice. Diet and exercise. Avoiding triggers, example, infections, stress. This structured approach should help you effectively manage a patient with suspected DKA.